After my recent visit to the sports medicine doctor, I've been pondering this question. Is it okay if the doctor gets one thing wrong? I mean, are the doctors allowed to get something wrong? I mean, it's a very difficult question that I've encountered many times, right? I've realized working with colleagues that we all make mistakes, brain farts, if you will. Some people have a bad day, like one doc was saying that, son's ill, blah, blah, blah. They're not going to be very good the next day, probably, right? Does it mean they're a good doctor? Well, it doesn't mean they're a bad doctor. I said they could be a good doctor having a bad day. They could be a bad doctor. How would I know? Except if I've seen them perform over time, right? Remember at a prior job, a patient complaining about a prior doctor. I was like, I think he's pretty good. Like, yeah, but he's like, well, I mean, he's pretty grumpy. I'm going to say probably due to the fact that he just had a new kid. I mean, I guess that's going to make you grumpy and jet lag because you have no sleep and blah, 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 right? I mean, what time zone are you with your baby? They don't know a time zone. They don't know day or night. But I guess the main question is, are there mistakes that are forgivable versus not, right? Is there something that's relevant to their specialty or their expertise? And getting it wrong means they don't actually know their expertise, right? There's always these mistakes you could tell, at least I could tell when people are writing, whether or not it's a mistake of thought or just a misspeaking or typo, right? Because some things are they just thought incorrectly. It's not a typo. It's just they're wrong. They don't know how to think through this thing. So went to see a sports medicine doctor because nowadays doctors have surveys and reviews. Made sure to emphasize that he looked at my x-ray of my knee. It looks wonderful. My leg looks fine. He repeated later again. And I already started off before he told me that stuff that, hey, I know my knee's bad. I already got a ultrasound when I was younger in Taiwan. The radiologist wanted to show us how ultrasound is used nowadays. And so, a lot of other places, not so much in the US, they use it for your joints. And it's pretty good, actually. Non-invasive, bedside, point of care. So my knee looks bad, but I have no knee issues. And the other girls, right, we're both like young people. She had a lot of knee pain and her knees look perfect, which is how much this correlates. Anyways, he says it looks fine. But guess what? The radiologist put in a report. And it does not look fine. I have osteoarthritis. I have Kilman or whatever, it's grade 2. It goes 0 to 1, 2, 3, 4. 4 is, I guess, the worst. And 1 is nothing, but 2 and above is considered osteoarthritis. So I have osteoarthritis. I could have guessed that, right? So when it's cold, my knees hurt more. But I'm able to function, and it's not a big deal, and I'm not there to see him for that. But as a standard routine, if I'm there for a knee pain, it's probably related to my lower leg muscles and stuff, you get a knee x-ray. So is it important that he says something that's completely wrong? Or do you go back and step and say, maybe he's not wrong, right? I like the guy. Maybe he meant that it's not that bad. Not anything to do with anything surgical about. But I don't know that that's what he said. See, first of all, he's a sports medicine doctor. He went through the family medicine route. He's not a surgeon. See, orthopods, surgeons in general, I think are very good at reading films because that's what they do. They need to be the one who determines they'll operate or not. You can't trust a radiologist. They could be wrong, but you're the one operating. You're like, yeah, even though I went through training for like 8 years, I still can't read these CT scans, so I'm really sorry I operate on Guy for his appendicitis when I guess there was none. I mean, that's not going to hold up in court. Surgeons are good at reading films. I give them that. He's not a surgeon, though. He's a sports medicine doctor in the department of orthopedics, but he's not an orthopedic surgeon. Is he good at reading films? I don't think it's forte. I don't think he's good at it. Does it matter that he said that? Should he said, with the caveat, I'm not good at this, but I think it looks fine? Was it bad he's so confidently saying that it's normal, it's perfect, it's wonderful, when it's not? Because it's just objectively not wonderful. I mean, it's not like an incidental finding the radiologist had, it's just the main thing, your joint. How is your joint space preserved? Right? How does your knee look? But then that goes into the bigger question is, if that's not his expertise, is it okay if he gets it wrong? Right? Does everybody have to get everything right? I think that's the difficult part with sort of judging and validating other people nowadays, when you yourself don't know that much. But you know they got something wrong. But I know enough to know he got one thing wrong. Maybe he got 2, 3, 4. Maybe he's getting everything wrong. How do I know? Right? I don't know the answer to this question. Is it okay if your doctor obviously got one thing wrong? Only one thing. But as far as you know, it could have been more things, but you just don't know enough to say yea or nay. I can only say that time will tell whether he's right or wrong about my knee and why I have pain in my leg. Gonna see the therapist, gonna do some exercises, we'll see how it goes, right?